Dr. Andy here. Today I want to show you shockwave therapy for an Achilles injury. We are coming up to marathon season. It's going to be kind of like late towards the fall. This is really common when we start to see a lot of our athletes, our runners, who are ramping up their training programs, and they start to develop a lot of Achilles pain and a lot of calf pain, and that's just because of all of the miles that they are putting in, right? So to train requires a ton of output from your body. So in order to avoid injury, you really have to make sure that you're recovering really well. And one of the most common strains that we get through tons of running is something down here in our Achilles, right? So our Achilles is where our calf muscles come down and attach into our back of our ankle, of course. And so because that is such a tiny little tendon with a huge muscle, it's really common through all of those miles that we start to develop some wear and tear into the Achilles, all right? So the type of injury we get through here, that's going to be a repetitive stress injury, so it's a chronic problem. One of the main issues is that this area starts to basically, underneath, we start to develop a lot of tiny little tears. There's not a lot of blood flow to the area. So what we want to do is we want to get rid of all of that, clear out all of the damaged tissue, and then start to bring in some stem cells to start that healing process, okay? So that's exactly what Shockwave is going to help us accomplish. Shockwave is going to get in there, it's going to break down all of the damaged tissue, all the little tears, mesenchymal stem cells flood the area, and we start to rebuild some healthy tissue. We also get angiogenesis, which is the formation of new blood vessels, which is obviously really important when we have this type of an injury as well. All right, so Shockwave is a little bit different from most of the treatment options that we have in the office. A lot of what we have is to treat pain, right? So obviously Shockwave can help with pain as well, but one of the big things that it can help with that nothing else I have can do, and that is tissue regeneration, and that's what's coming from those stem cells that I was mentioning before, okay? So treatment takes about 5 to 10 minutes. What we do is we put a little bit of ultrasound gel on the Achilles. Actually, when we do it, we're doing both the Achilles and we're going to do the big calf muscles as well. Right now, I'm just going to show you what we do for the Achilles, okay? So a little bit of ultrasound gel, that helps the sound waves that come from the head of the shockwave transmit deeper and better into the tissue, so you get a much better treatment, okay? So when we do it, again, treatment takes about 5-10 minutes. At the beginning, it can feel a little bit of uncomfortable. We're looking for pain levels of around, or discomfort levels of around 3-4. You're certainly not dying. You can definitely handle this type of discomfort, okay? We find some tender areas, and what we do is we kind of sit right on that tender area. Oh my goodness, I don't even have a headpiece on it, I'm sorry. Here we go. Woo! Alright, so we put our headpiece on. That's the transmitter head. That's the part that actually sends the sound waves down into the body. So, using the ultrasound gel, we turn it on. What it's doing is it's putting little pulses, little impulses down into the tissue. Those impulses are breaking up the scar tissue and the adhesions, allowing for that healing to take place. And so we do a couple of minutes down here in the Achilles. We might even put a little tension through the bottom of the foot so we can bring that Achilles tendon up towards the surface. We find some areas that are definitely a little painful. We kind of hang out in those spots. This area we'll do for a couple of minutes before we head up into the calf and do some of the deeper muscles as well. Because in the end, you're wanting to be able to get the entire muscle group, okay? What I tell most of my patients, as I said, a couple minutes for treatment, you might feel sore for a couple hours, maybe at the worst the rest of the day. Typically the next day you're going to feel fantastic, no problems there, so it's not like the soreness lasts for multiple days, okay? After treatment, you're going to want to do things like avoid like hardcore, intense, explosive exercises. You're probably going to want to avoid CrossFit for maybe about 24 hours or so once after you do shockwave therapy, okay? So that's an example of what we do for shockwave for an Achilles problem, especially for our long distance runners as they start to ramp up in their training season, okay? Hope this answers some of your questions, but if you have any more, send them my way, and always remember to live with passion, not pain.